Good boy. He's a good boy.
I was expecting this really poorly three-legged dog to come in, and the van pulled up outside and we could hear the biggest woof ever, followed by the back door opening and Marcus jumping out. We instantly fell in love with Marcus. He's adorable.
Such a handsome boy. I don't know how anyone could have just left you like that. How could he do that to such a handsome, lovely boy?
We thought that maybe the reason his back leg was missing was he'd had a tumour before, a cancerous lump, and it was removed. So we thought possibly the new lump could also be cancerous. So our thought was, look, this guy is going to be put to sleep if we don't take him in. Let's at least give him a chance. Let's get the lump tested.
Hello, ladies. How are you? Hello, mate. You must be Marcus.
This is
You're a
Marcus.
handsome chap. Oh, thank you. Big smooch. I walk into All Dogs Matter and immediately am greeted by a beautiful, big, buffy black Labrador. And that's where you're forgiven to think he's got 4 legs? No. He's only got 3.
It's unusual to actually get a dog that's come in that's already had treatment and then be abandoned.
He seems like in pretty good nick. If anything,
Yeah,
he seems like he's been
well looked after.
overwintering quite well, yes.
Yeah, well, sadly, he's chipped to someone, but the owner's failed to come forward, so...
Ooh, you're very handsome.
He's found himself without a home. What we found is this lump here, which has caused some concern. You know, I'm guessing, I don't know, you're the vet, but this leg may have come off because there was a tumour, possibly, and now it's maybe spread. He won't manage on 2 legs. It's unfortunate it's the same side.
Marcus has been to the school of hard knocks. He has not got a home anymore, he's lost a leg, and now we see this lump on his leg. I mean, how much bad luck can one dog have?
We can't put him up for adoption, you know, because we don't know what that lump is.
Yeah, it is solid and it does feel homogenous, so it feels all the same.
Right, okay.
So there's some positives there. What I think we need to do is to take a sample of the cells present in
Okay.
this lump
Let's see
and find out
what's going on, yeah.
Yeah. And if we find that this is a malignant tumour, something that we need to be worried about, then that doesn't bode well for his future.
The worst case scenario, we'll give him a bit of time and make his life as comfortable as we can. And hopefully if it's nothing and it's benign, he'll go to a new loving family and live the rest of his life as well and happily as he can.
It was unlucky on one hand that he ended up in the pound as a stray, but at least he was then passed on responsibly to a charity that can.
Well, particularly
take
as he
care of
was
him.
on sort of death's row.
Sadly, hundreds of dogs in this country are put to sleep each week. Councils can only do their best. They can only keep dogs for a certain amount of time.
At the worst case, I'd rather be there and sit with him than let him be put to sleep by himself on a cold floor. That would be very sad.
He's been abandoned by someone who just didn't care what happened to him, and we feel at least we can offer to take that abandonment over and give him some quality to what could be the end of his life. Had we not been here, he wouldn't be here now.
At least he's got a chance now. He had no chance before, so he's got a
Give you a
chance.
chance, shall we, mate? Hey? Hey? Yeah. And if nothing else, we'll give you a belly rub. You are a very handsome boy, aren't you? Yeah. Gonna be a good boy? Are you gonna be a good boy? Are you
Yes,
gonna
that was
be
a
a good boy?
positive yes. That was yes in dog language.
I love working with people like Ara because they just have massive hearts, and she just wants to do everything she can to give Marcus that last chance. As far as Ara's concerned, that is definitely not going to be the last page in this story. You'll be very brave. I'll stick a needle in your arm. So this is a microscope slide box full of, guess what? Microscope slides. Yeah. What we're going to do is we're going to pop a little needle into that nasty lump. We're going to take some cells, we're going to pop it on a slide, we're going to send it to some smart people at a lab, and they're going to tell us if we should be worried. How's that sound? Are you worried? No.
We'll be waiting with bated breath and hoping that that comes back as benign. And as soon as we get that result, we'll sort of start looking for Marcus's forever home. That's our hope.
He's such a special boy, and we're just hoping and praying for him that it'll all be good. An extra kiss for luck.
Yes. Yeah, you deserve it. Boy. Hello, Nina.
Oh, yeah.
How great to see you.
Yeah, me too.
Hello, Marcus.
Hi,
Gina, look at this guy. What a handsome fellow, isn't he?
Hi,
Say hi to Gina.
Oh, lovely kitty. Hi.
Oh, he's looking great, isn't he?
Oh, he's wonderful. When we saw Marcus with the lump on his leg, but yet being kind and all of that, we saw We've got to try, see whether we can improve his quality of life. Can we remove this lump? Just give him a chance. Oh, you're a good boy.
You are amazing, boy. Yeah. You're getting lots of love from everyone.
Oh, yes.
You better be.
He's wonderful.
Ooh,
He's so kind. Marcus came to us so loving and caring that he does deserve that chance, no matter what. So some people let him down. Some other people will actually not let him down. And this is us.
Cuddles are over, mate. Me and Nina need to have a chat, so let's go into the consult room, shall we? Come on then, big guy. This
Even
way.
though Marcus is very happy, loves his walk, loves being around us, there are a few signs that are a little bit worrying. He drinks a lot of water, he gets tired very quickly. I'm ready for the best, but I'm also a little bit ready for the worst.
I'm a little caught out by the result that we've got today. We found some cells called spindle cells.
Right.
And spindle cells are the starting blocks of a type of tumour. And the worst case scenario is it can be an incredibly nasty tumour called fibrosarcoma, which can spread to all areas of the stomach.
I wanted to burst into tears, but I didn't want to show this emotion to Marcus because being so happy in front of me and not knowing what's happening, then all of a sudden, me, the carer, just project this sadness and anxious, and I don't think it was fair on him, so it was hard, but I did kind of hold on to my emotion and try to keep the happy face. Do you think it has spread already, or will the cell just be in the tumour?
At this stage, I don't know.
And do we have a way to find out?
We do, absolutely we do. My suggestion in this instance is that first of all we need to stage it. There's a spectrum from the not too much to worry about, that might come back, a little lump on the leg, not too much to worry about, all to incredibly aggressive, horrific type of cancer. What we need to do is to determine if the tumour has spread, where it's spread, and what type of tumour it might be. In this instance, the worst case scenario for a normal dog, you'd remove the leg. We don't have that option.
No,
Ken.
we don't. We can't do that, obviously.
I know and I can feel already how much of an impact this dog's made on you. So I know
He's
that
wonderful, Scott. I don't understand. How can you give up on such a loving dog? I don't understand. He hasn't got anything inside him that would be like show something wrong. Yet he's got this now. It's really unfair. I'm so grateful I've met him. And this is where I think his kindness has paid off, because finally, with you, with me, with us, we won't let him down, no matter what.
No, you're damn right we won't.
Good boy.
We won't.
He's yours, Carl. You look after him.
I will, I will.
Yeah.
Come on then, mate, let's go. Let's go and see all the nurses, shall we? Come on. Good boy. Look at this guy.
Oh, hello.
This handsome fellow is Marcus.
Hi, Marcus. Oh my God, look at him. I know you said you were bringing me a new man that I might fall in love with, but
There you go.
yeah.
Isn't he gorgeous? The next step in the process to understand Marcus's tumour is something called staging.
Oh, you're such a sook. Look at you.
What we need to do is do various x-rays in order to determine if the tumour has spread, where it's spread, and what type of tumour it might be. Whatever God or not you pray to, let's just pray that this dog is going to be okay.
Really need the lights off.
That's it.
There we go.
X-ray.
Is this just normal?
Yeah, there's no tumours I need to worry about there. It's looking pretty healthy. Okay, good. Let's move on to abdominal x-rays then. Okay. Generally this type of tumour will spread to the spleen. But so far so good. That looks like a nice, beautiful, healthy spleen of a beautiful dog. So that's good. So I'll go and give Nina that good news, and then you can get set up for taking the lump off.
Will do.
There isn't any presence of cancerous lumps, so that's really great news, and it does mean that at least at this stage, the cancer hasn't spread. Hey, yeah.
Scott.
So, good news.
Ah,
Yes. So no tumours I can see. All right.
Yeah.
What I need to do now is to actually move forward to surgery. The guys are prepping him up downstairs.
Okay.
And I'm going to be taking the lump off. Hopefully.
so it's looking good.
It's looking better than it was before the X-rays.
Okay, which I take it as a good.
Yes. It's great news that this cancer, whatever it is, hasn't seemed to have spread anywhere. And immediately Nina, she's a positive, optimistic person, grabs onto that.
I rely on you now.
Rely on me,
Yeah.
rely on my team. I've got the A team downstairs, so
That's wonderful.
you're in good hands.
Okay, brilliant. Oh, I'm
Okay.
so happy. Oh,
right.
I'm so happy. It's brilliant. Very good news. Thank you so much,
Right.
Scott. Thank you.
Pleasure.
Good luck.
Thank you.
All the best.
This is a rocky road and I don't know where it's going to go, and I only will know once I actually remove the mass. It's sizable, I'll give it that. I kind of need to have a look at this mass, remove it as much as I can, and then remove as much skin as I can, but not too much, to the point where I can't close it. So I need to just be very methodical about this and be willing to change my approach as I go. Bloody evil thing.
It's just so vascular. It's quite amazing.
It's like a tennis ball.
It does. It's mad.
It's quite a sizable mass, this. It's very, very vascular, which means there's a huge amount of blood supply to it. And generally, cancers can be quite greedy when it comes to blood supply. They like lots and lots of energy to grow and do their evil pursuits. This thing is stuck firmly to the skin on this side. So to remove it completely, it is going to prove very difficult. I know I'm not going to be able to remove the whole thing. It's impossible. I'd have to take his leg off, and that we know isn't possible. So I'm just going to take as much as I can, hit it as hard as I can, and hope for the best. Get out. Evil thing. The problem with this is that it's so tightly adhered to the skin that I really need to be taking all the skin off that I can. But I can't take all the skin off that I want to, because if I do, then I'll have a big gaping hole that I can't close. So it's there's going to be some compromises here. This tumour is a horrific, ugly, nasty looking thing. It's horrible and it's invasive. It's going deep into Marcus's leg. That's a good bleeder there, James, please. Just there. Normally in potential cancerous lumps, you have to remove around 3 centimetres in all directions. Well, if I take 3 centimetres in all directions, he loses his leg. But he can't lose his leg because he's already lost one. So all I can do is try and remove as much of the tumour as I possibly can, and then just hope like hell that the result comes back that it's one of the less nasty ones. Incredible vasculature. Like, you know, normally you expect a little bit of bleeding, but this has got proper blood vessels going to it. I'd be impressed if I wasn't so horrified. Well, that's better, coming out a little bit better there. This is a bit of an emotional roller coaster, really, because you know, we all want the best for Marcus. That's probably why I'm getting a little bit more annoyed with this than I would normally. It's just horrible, and to think it's attached to such a beautiful dog is actually just upsetting. Okay, so I'm nearly at the point where this is going to come out.
Wow.
It's pretty grim, isn't it?
That's absolutely foul.
That's disgusting.
Just looking at a cancer, you can't tell if it's malignant or if it's relatively benign. This does not look nice, however. So I am concerned about Marcus's future, but I need to hold fire on my concern. I need to be there for Nina through the process. We'll send it off to the lab, and fingers crossed. So
now we just have to wait and just see what happens.
Yeah.
Little sweetheart.
And just be really hopeful. I mean, I still have hope that we'll get a result which means that he will live a number of happy years, but we just need to be patient and be prepared for the worst as well. So it's going to be a tough wait.
Yeah. Today is a very difficult day, but I have to hold on tight about the fact that no matter what, we will do our best to give him that quality of life. Will it be a month, 6 months, a year, 2 years? I have no idea. But during that time, for sure, he will be cared for and never ever found himself abandoned again. You've got a nice bed waiting for you. And I know someone who's going to sleep next to you tonight, so that's going to be me. Just to make sure you're okay. Yeah.
Yeah, good boy and good girls. Yeah. We've got a really good dog here, haven't we?
Because I wasn't able to take all of the tumour away, there is a big chance that it might regrow in the same area. And if we have to remove the tumour again, then we will do. But the chances of it actually spreading to other parts of his body are really low, and so that's really good news for the future of Marcus.
Do you like your new friend? Yeah, is that nice? Is that fun? Oh, little sweetheart, we need your bandage off. And you'll be fine. Ah, no.
It's true to say that Marcus is a dog now living with cancer, and that sounds terrible. But the great thing about a dog is that they're none the wiser, so Marcus can still remain the happy, gregarious dog that he is and live a wonderful life with Nina.
Wow, what a nice ball you've got. Django, come on, bring your ball. Slowly, slowly.
It's wonderful to think, with any luck, that Marcus will now live a long and happy life, carrying on being the big, beautiful boy that everyone's fallen in love with.
Who can give a paw? Paw, yeah. What about you? Can you do a paw? You can do treats, that's for sure.
Obviously, we hope for the best and we will see what happens, but for the moment, for sure, he's really happy and he's fine.
You are doing very, very well. You're getting better by the day.
Hello, we're back. Good, we're back again.
Oh, hello, Bosley. How's he doing?
He's all right. Yeah, we brought him in for his checkup with Scott.
Yeah.
He obviously doesn't want to be here at the moment. He's got a bit of a grump on his face.
You don't look very happy, do you,
He's
sweetie?
not impressed.
Do you want to have a seat,
Yeah.
Hannah? It's got to be right with
Thank you.
That's all right.
We found out pretty soon after we rescued Bosley that he had issues with his bowels and food intolerances. He had a lot of diarrhea, and for the first 10 years that we had him, it was always managed by diet. And then we noticed last year he started losing a lot of weight. I'm conscious he's getting to that age where you start to worry that there might be other things going on, and I can't quite imagine my life without him. I would never give up on an animal. He's very much part of our family.
Hi Hannah, how are you? Hello Bosley. Hello champ. Come on in. We'll try and be gentle. Come on in.
Come on, Boo.
Up on the table there. How'd she come?
Come on, Bosley.
Come on. Good lad. Come on, beautiful boy.
I'm a bit nervous to always, when I bring him in for a consultation, always nervous to find out if there's anything else wrong.
So what's been happening, Hannah?
Last weekend, he pooed in the kitchen, and I noticed there was some blood in the poo.
And it was red blood, was it?
Yes, it was red.
Okay. All right.
Quite bright.
So when there's red blood, it's actually blood from quite far down the gastrointestinal tract. It's not bleeding from further up, because if it was, it would be digested like all the rest of the food is and would come out almost like a black colour. So if
Okay.
it's bright red, normally it's straining. And as we know, with IBD cases, diarrhea is commonplace. So a little bit of straining and a bit of blood is completely fair enough.
That's good to know.
Yeah.
Oh, he's purring now, so he's obviously getting happier now. He's liking the massage, I think.
Giving Sarah a little tummy massage. Okay, I'm just trying to feel all the structures of his abdomen. But I'm a little bit concerned about that. There is a little bit more thickening than normal
Okay.
in one part of his gut that I can feel.
It's not good, Boo.
It's not good news at all. I must admit it's a little bit of a shock.
I thought he was doing really well. He seemed to be putting on lots of weight and seemed a much happier chap at home.
Bosley has had inflammatory bowel disease since he was a kitten, and he's been quite well managed for quite a long time. But unfortunately, when I feel a lump in the gut like that, a lump that seems more solid than the gut around the outside of it, I am concerned that this time round it could be cancer.
Oh, Boo-boos.
I'm sorry. We'll sort you out. Yeah? We'll sort you out. He's still purring. Isn't it good that he doesn't know what the C word
Yeah, he's
means?
got no idea, bless him. When you hear the C word, you panic. You start to worry that that's it, your cat's days are numbered.
Right then, Hannah. So, we'll take your beautiful man and take him downstairs and do what needs to be done.
Look
All
after
right?
him.
I will.
Be a good boy, Boo. Be behaved. Yeah. To have to leave him here, it's really worrying. I'm going to be by the phone all day waiting to hear what's gone on.
Say bye, Mummy.
Bye-bye, darling. See you later.
Bye, mate. Say bye, Mummy.
Bye.
So here's little Bosley.
Hi, little Bosley.
Isn't he gorgeous?
He's a very handsome boy.
So what we need to do is to do some x-rays, do an ultrasound, get all the information, and then work out what the next step should be. But I think it may well be surgery.
Okay.
So you guys need to make sure that you are absolutely on it today, because he is a 14-year-old geriatric but very much loved cat.
No pressure.
No. It's all right, Emma, we've got this.
We do.
We've got this. You'll be fine, little one.
He really is so handsome, isn't he?
Very, very gorgeous boy. He won't believe what his mum calls him.
Oh God, go on.
She says that he isn't particularly bright, a little bit thick, and so she described him as like a male model.
Didn't you do a little bit of modelling in your career at some point?
Might have.
Oh, it's fun to wind him up, Bosley.
I'm a real vet now, though, I promise. Hey.
It's a good job for you, isn't it, buddy? Hey?
All right, mate, here we go. So right now, we'll do some x-rays and some ultrasound to get to grips with where this thickening is, what it might be, and what I need to do about it. X-ray. That's the mass there. I'm worried about. That does not look very nice. Very solid looking, very hard. The x-rays are throwing up something really quite strange. It looks like he's got a really solid piece of poo in his lower bowel, which is odd because he presented with the condition of diarrhea, so liquid poo. So that's a bit weird. And the mass that I can feel is absolutely around that position. So then I ultrasound to see the structures, the layers there, and I can see that it's thickened, but I can't see a specific mass. Unfortunately, it's just not clear on this, so I'm just going to have to use my own eyes rather than ultrasound or x-ray. Hi, Hannah. Hello. So, got your boy on the table. We've just done some x-rays and an ultrasound. There is still concern that it might be something that we should investigate right now.
Okay, all right, lovely.
I will now crack on with the surgery, and I'll open him up and just see what's there. And depending upon what's there, Worst case scenario, if it's something that I can't do anything about, I will call you again before I close him. But hopefully I won't be doing that. Okay?
Thanks very much.
Take care. There is some thickening of the gut, and he does have inflammatory bowel disease, but there is the possibility of cancer, and I cannot allow that to be ongoing without answering that question. So I do need to open him up, and so I can see it with my own 2 eyes. There's the issue.
That's not very normal.
No. The main abnormality that I can find is in the large intestine. The cecum, which is a pouch at the start of the large intestine, is full of hard poo because that can't get past what seems to be a stricture, a narrowing, almost like a traffic jam. You know, 4 lanes is turned into 2, and so all the traffic bunches up, and that's exactly what the poo's done in the cecum. We'll remove these little tissue adhesions where they've contacted the colon, and hopefully it'll fix the problem. Yeah, although it's extremely weird, it's good news because it doesn't look like there's any cancer anyway.
It's fantastic.
It looks great. We'll take some biopsies of the lymph nodes nearby just to make sure that there isn't any cancer cells and I can give Hannah the all clear. But let's close him up and tell his mum.
Great stuff.
It's a massive relief when I can close Bosley up, knowing that we've made a big difference, and hopefully his large bowel is going to be functioning much more normally now. I've removed those little attachments, those adhesions. Okay.
I can't hear any muffling.
When I was listening to it, it was completely muffled and then a part stopped.
Then straight away, we're plunged into a huge shock.
I could not hear it. Is it there?
Emma discovers that Bosley's heart has suddenly stopped. She quickly goes to work, she does a bit of CPR on him, and it really is touch and go. Okay, keep that stethoscope on his heart, okay? Yeah, there's a heartbeat there. Okay?
Yeah, it's not a clear chest at all.
Is that all right?
Yeah, his heart's going, but it's just not happy with how his chest sounds in general. I'm worried about his blood pressure now.
Okay, just let me jump in here and then close them quickly. Okay, let's whack those fluids up, put them up even
Yeah,
more.
his pressure's only 30.
Yeah, his blood pressure's a little low, but his heartbeat is back. Okay, let's wake him up.
I don't appreciate scares like that.
Breathing much better now. We're awake now. You.
Thankfully.
It's just so heart-wrenching when something like that happens, particularly as we're about to deliver good news.
Absolutely.
Yeah, we're feeling euphoric, and what happens? You bring us right back to earth again, don't you? Mm-hmm. A bit starey, mate, aren't you? So you cannot see my finger. Really sadly, he has had a period of time where his brain has been starved of oxygen, and it's only once he fully recovers do I work out that in fact he's now blind. Come on, mate. I'm hopeful that his vision may come back, but I can't promise anything.
Bosley even brought Mum. Come on through.
Hey, boo.
Grab a seat.
Oh, look at you. You don't look happy.
This has had major surgery, Mummy.
Hello, sweetheart. Oh, you poor thing. What has been going on with you?
To say it's been eventful is a slight understatement.
Right.
Good news is that it looks like he doesn't have cancer.
Yeah, okay.
Yeah. Bad news, however, is that as soon as I was closing him and feeling very positive about things, he decided to have a cardiac arrest.
Poor thing. Oh, darling.
But
But
what's happened is during the period of time when he had his heart stopped, even though it was for a few seconds, his brain has been starved of a bit of oxygen. And unfortunately right now, he's blind. I'm so sorry.
is that permanent then?
Look, all we've got to do is just hope and pray. 70% of cases come right, okay? And it was such a short period of time. Emma jumped in there so quickly. We got him back as quick as we possibly could. I have seen it before, and they do come back.
Okay.
So he's going to stay in hospital with us tonight.
So you'll know.
Well, I'm hoping by tomorrow.
Yeah, we'll have a better idea as to how permanent. Okay.
Yeah. I just hope his brain just needs a little rest and a reboot, because the eyes are fine. It's not that. It's the part of the brain that processes the images that's been affected. And so with 24 hours worth of oxygenation and love from the nurses, fingers crossed we'll get the result we're looking
Hello, darling.
for. See him twitching his ears, he's definitely hearing you.
Bosley.
I'm looking at something, whether it's at me or not.
Hey, Bosley, what's this?
So I've been looking after Bosley since he recovered from surgery, and we're just really keeping an eye on his eyesight, testing him every couple of hours to see if he can see anything. Might you have a look at a toy?
Hey, Bosley, what's this? What's this, buddy? What's this? Can you see this? Hey, what's this?
It's not something we see happen often in anaesthesia, but it does happen. It is a risk of general anaesthesia in our patients, and we just have to hope that his sight does come back. Worst case, it doesn't. I think he's maybe a little bit better than yesterday, but time will tell.
Hey, I'm gonna need Uncle Scott to come down and have a proper check.
Hello, Boz. Hello, mate. Hey, did you pad me away? Eh? What does that say? It's such an exciting moment to be able to send home Bosley, but to be able to do so and know that I'm doing it with his vision back, it's just such a relief. Hi.
Hello. Hey, sweetheart.
There he is.
Oh, I've missed you.
You've come to see him, but now he can see you.
Bosley, hello. I'm just really happy that he's got his sight back and life can hopefully get back to normal.
Gee, you've put everyone through the ringer, you monkey.
It was a
haven't
bit
you?
dramatic, Bosley. Slightly unnecessary. Oh, I'm so pleased.
Yeah, I'm
Thank
so
you
pleased
so
for
much.
you.
I can't believe he's got his sight back. It's brilliant.
It's great news to be able to send him home and he's still alive.
My kids have actually made you a little card.
Oh, wow.
I didn't quite give them the full picture, but they knew that it was quite serious.
Oh, wow, that is just so lovely. Thank you. I'm having a quick cry. Thank you, that is so beautiful.
No, they
Thank you. It's...
we all can't thank you and Emma for everything you've done for him.
It's so great that I can give Bosley back, being able to see his mum. But now we've just got the last little test results to come back, which was the samples from the lymph nodes. I'm hopeful that that will be absolutely fine. It'll come back as clear and great news for him. But he definitely can't have another anaesthetic again, so we do need to accept whatever the results are. Bye, mate.
Say goodbye.
See you later. There we go. All right. Bye, mate. All right then, we'll see you very soon.
Thank you.
Cheers.
Thank you so much.
All right.
Bye-bye.
Say thanks to the kids for that card.
I will do.
Bye, guys. Hello. Hi, kids. Hi, Hannah.
Hi, Scott.
Where's Bosley? I can't wait to see him.
Come on in.
Thank you very much. Thank you. Where is he? Today I've come to visit Hannah and the family and to catch up with the beautiful Bosley at home just to see if he could see me. He's looking great, and the fact that he's actually looking at all is pretty cool, isn't it?
I know.
Yeah.
Brilliant.
Hopefully Scott is going to have some good news for us. We definitely need it because we've been through the mill with Bosley.
Let's just manage his condition, give him lots of love, and have him see through the rest of his days with his eyes intact and functioning.
Indeed.
Absolutely.
Sounds good to me.
Yeah.
Hey, does that sound good to you? Is that, yeah, just no more surgery, thanks.
Definitely, thanks.
And some more really great news for you guys is that the pathology came back that he definitely doesn't have cancer, so
Great.
That's
hooray.
brilliant.
That's a relief.
That's a relief.
So I think collectively we probably have to say that he's used up at least 8 of
At
his
least.
9 lives.
Yes.
An easy life now.
Yeah, no more drama, please, Bosley.
Yes, Bosley, please not. My heart can't take it. I think the future for Bosley is very bright. He has definitely put us all through the ringer, has really put on a huge amount of drama, but I'm hoping now with good management and Hannah and I working together, we can give Bosley a very calm, very relaxed, very pain-free life. Wow, the first image of this house, straight away there's a cat that's looking out the window. Hello, can you point the way to the cat sanctuary? This way. Yeah. And then turn around the corner and there is just so many beautiful felines just waiting to greet me. Wow. Hello everyone. Hello. This is cat heaven, isn't it?
Hi, Scott.
Hi Liz.
Hello.
How are you?
Fine. Welcome to Catastrophes and our
I
home
love
in the
it.
sanctuary.
This is a lot of cats.
Yes.
So it started off with just looking after a few and then
Yes.
rescuing
Kind
a
of
few.
started with about one little young ginger cat that needed help, and then
Right.
people get to know
Yeah.
you, and then it just goes on from there. Come on. I think it's probably from my childhood. If ever a stray cat turned up, you didn't pick up the phone and get someone to come and remove it. You gave it food, you looked out for it. That was it. You just did something for the animal to save a life. I think I thought that with spaying and neutering, numbers were being controlled more, things would be improving. But the demand is just absolutely huge. The phone doesn't stop ringing. You could end up with 1,000, I think, quite easily.
Yeah. So you take the cats that no one else wants.
We tend to try to help cats that are perhaps more difficult to home. They're the ones that we try to help, the ones that have really got no chances left.
I'm assuming you didn't get me here just to stroke some beautiful cats.
No, we have a very particular cat called Janet. We call her Janet from another planet because she looks a bit strange. Can you come and have your tea? Seeing Janet for the first time, I could see there was a big problem with the mouth, with her coat, that she obviously couldn't clean herself properly. Good girl, Janet. She sticks her tongue out and it's because she has a fused jaw. And I knew that this could be a real challenge. We might be able to help her, but it could go the other way. But whatever happened, we had to do the right thing for her so she wasn't suffering.
Hello there. So which one of these beautiful felines is Janet?
Right, that's Ron Turner. This is Janet.
Hello, Janet. Hello, gorgeous. Oh, I can see the tongue. I'm just going to have a fit. Wow, so that is it. That is literally as far as I can open it. Wow. Janet's a very lucky cat that she's found herself in the loving arms of Liz, but I can tell you what, this cat is still struggling. She can't open her mouth, so therefore she can't groom herself properly. She can't eat properly either, and within the mouth I can see some really rotten teeth. How can anyone do a dental on a cat where you can't open a mouth? And any ideas as to how that might have happened?
I don't know if you think she may have been born with this or if it's from, a road traffic accident where she's taken quite a bad knock and it hasn't been dealt with at all.
Let's have a feel. So the mandible, the actual lower jaw, feels all right. It's just when you get back into the joint.
Oh, right.
And that's where they're simply just not opening enough for her to open a mouth.
And she tries to wash herself and keep herself clean, but she looks quite sort of mucky and discoloured around her front legs.
You do, sweetie, don't you? You're constantly drooling. Hey? Hey? Yeah, let's have a look at you. Hey? Oh, wait. Janet's case is a perplexing one. I don't think I've ever met a cat that you couldn't open its mouth. So I don't understand what's caused it, nor do I know if I can fix it.
She wants to live, but I think we've got to try and...
Do something.
Yes,
yeah. I think the first step is CT scan. Let's understand what's on the scan.
Okay.
And then I would suggest that as long as you're quite brave,
Absolutely.
then we may have to go through a surgery.
Yeah.
So.
Now, if we can make her quality of life good, I think that's what it's all about.
So at the moment, I have just as much concern and trepidation about this journey as Liz does, but together we're going to do our best for Janet. It's going to be a long process. You ready for it?
Yeah.
Hey, Aurora.
Hi, Scott.
Good
So
to
nice
see
to see you.
Thanks so much for coming. Chuck your bag down and let's get to grips with this pretty shocking CT image. I'm very lucky today to be joined by a specialist oral surgeon, Aurora. She has come all the way from Spain to help me with this procedure.
This must have happened a long time ago. We don't know what happened. Probably a road traffic accident or something.
It's brilliant to have this level of experience because it is a major thing we're going to have to do on Janet today.
Both hinges were broken and healed in wrong position.
So basically her jaw at the moment is hitting her eye socket.
Yeah.
Wow.
Something must have happened long ago, some kind of trauma, because both condyles are broken and fused in a wrong position. Now her teeth are also infected and she's in pain now.
So we remove a rusty hinge from her jaw. We hopefully see it open a little bit better. We clean her teeth and we give her a good life.
Exactly. Good plan. It's going to be a hard surgery. I want to do it for her. I feel good that I'm here, but it's going to be a challenge.
Good girl, Janet. Okay, Janet, here we are. Uncle Scott's. Hello. Okay, thank you. It's Janet from another planet.
Nice to meet you. Did you want to have a seat, Liz?
Yes,
Got me
of
right
course.
with you.
Okay, thank you.
So we're going to see Scott to see how he's interpreted the scan and the report from the specialist. So this is the real nitty-gritty for Janet. But hopefully good, all good.
Hello, Liz.
Hello.
How are you, gorgeous?
I'm okay. How are you?
I'm really well. Hello, Janet. It's your big day today, isn't it? How are you? Hello, gorgeous. Come on, then. Come and see Uncle Scott. That's a good girl. Right. So it's a hell of a CT scan. It really is. But what we think is that years ago, she suffered quite a significant trauma, which meant that she had fractures on both sides of her jaw.
Crikey. Yeah.
And the body's tried to fix itself, but just not done a very good job. So what we're going to try and do today is to just remove the hinge completely. The muscles and the ligaments and everything around the jaw will do the work of the hinge joint, but the hinge is not helping, so we need to get rid of it. I'm quite nervous about this procedure because I know it's going to be a long and very tricky process, so we just need to work step by step and hope for the best. Give her a big kiss of good luck.
Brave girl. Mummy's with you. Mummy loves you. You've got lipstick on you now, darling, haven't you? There, good girl, good girl. I'll see you soon. Everybody loves you.
So, Aurora, this is your patient. This is Janet. And Nathan, if you just hold around the shoulders, let's just have a quick look at this mouth and you can see that's about the limit of being able to open it. Really, really disgusting teeth. Really sore gums. Also, we can see that alignment issue there. You can see those two canines butting up against each other, can't you? Sweet dreams. It's pretty shocking. This cat has struggled for a very long time with a mouth that she can barely open. She has teeth that lock together, and also her tongue is very swollen, very sore because of years of hanging out, and that also is causing problems for her. We're going to sort you out. Yes, we are. Janet's already been through a CT and she had to have a tube down her throat then, so that would have inflamed the back of the throat. God, just getting in there. Gosh, I can't see a thing. I might have to try and go blind and just see if I can get it. And then alongside that, she's got a very thickened tongue, so that's almost making a speed bump. So trying to put a tube down there makes it one of the most difficult intubation processes that I've ever had to face. There's actually no movement in this jaw, so it's just about
Yeah, it's not easy.
getting the access.
That's not gonna fit.
Yeah, that's literally as open as we can get it. Goodness me.
Yeah, that's in.
Yes. Get in. Okay. All right. Okay. Onto the gas. A massive sigh of relief when it seems we finally have the endotracheal tube in place and Janet seems to be well under anaesthetic.
So let's go for it. See, it's awake.
She's just very light, so we're just concerned that her anaesthetic isn't deep enough. Otherwise, she wouldn't keep waking up.
That's it. That's the problem. Yeah, she's totally awake.
The relief that I felt as I thought the tube was down is short-lived. What's happened here is that the tube going down into Janet's throat has shifted and she's got so much saliva in the back of her throat we can't actually see. So what we need to do is perform what's called a tracheostomy, basically placing a hole through her windpipe and then down into her chest, which will allow her to breathe and also for us to maintain her anaesthetic.
Okay.
Let's get some oxygen in this cat. It's become an emergency situation. This cat is in danger and we need to do something fast. Can that light be on this angle coming down?
Okay, there we go.
Yes. Okay. Support that the whole time, Sam. Don't let that tube go. Okay. So now, thankfully, we're in a position where we have an established airway, which wasn't the case before, which is very nerve-wracking indeed. But now we have a tube down her throat, done this way rather than down her mouth. But actually, that's allowing us to have a look at the mouth so much easier. And now we're actually going to remove the left canine. Aurora starts the procedure by trying to remove the teeth that seem to be locking or touching each other and causing the inability of Janet to open and close her mouth. We start removing one after another, after another, after another.
Another healthy tooth.
Yeah. Shame it has to come out, but it does. So that one needs to go as well. This really is a marathon. In all, we have to remove 4 teeth, the ones that were contacting each other and stopping Janet's jaw from closing. But now we have to try and help open it a bit more, which means taking out the fused hinge on the left side of her jaw and hoping that this will be enough for this poor little girl.
See, the joint is right here.
Yep.
So we're gonna go for it.
It's actually quite a difficult surgery to get to. There's lots of muscles, and also with Janet, there's lots of scar and fibrous tissue around it. So it's a really difficult surgery, not clear cut at all.
Yes.
No more hinge.
No more hinge. So, move it now.
Let's try now.
And it doesn't really help.
We've done quite a lot of stuff with this cat and still she is confounding us because we really hoped we'd be able to open more there and we just simply can't. We removed the joint that we knew was abnormal, but that didn't make a huge amount of difference. So we turned Janet over and also assessed the hinge joint there.
Okay.
Yeah, so that's the second hinge joint now removed.
I am happy we can close her mouth more, that's good. And she can open her mouth much more, that's good. But not as much, yeah, that's enough. We were complaining too much, it's enough.
Yeah. You are complaining too much. I think you've done very well. It's been an absolute Herculean effort by everyone involved today to get Janet through this surgery, but poor Janet, bless her, 4 hours of major surgery and certainly not very pretty surgery either. But she's come through it. The mouth is moving much more freely. It's certainly far from normal, but it's opening about twice as much as it did at the start of the surgery. Okay, and we're done.
It has been a very difficult surgery, long, and I'm knackered. Scott taught me that word. I'm really tired.
We've definitely made some inroads, wouldn't you say? But hopefully it's the start of a new life, eh? Although the surgery is over, Janet's work is still yet to really start. We need to do a huge amount of physio on this poor girl. That was a long one, wasn't it? Getting her to use this new jaw, get her to start flexing her muscles a little bit more, allowing for more flexibility in those joints, and getting her mouth open again. You deserve your bed tonight. And so do I. There you go. All right, good girl. It's all right. It's been a really lovely thing to be part of helping Janet. It's been very stressful at times, and poor Janet's been through hell and back. But we're really hopeful that this poor cat can finally live a comfortable life where she can have her tongue in her mouth, she can swallow and chew and just open her mouth normally like a normal cat. Let's hope. There you go. All right, good girl. You're so brave. Hey, hi, Janet. How are you?
She's doing very well.
Yeah?
Yeah, eating biscuits this morning.
No way.
Yeah.
You're eating biscuits. What a clever girl. Listen to her anyway. Janet has made a miraculous recovery. This cat is so brave and just so amazing. That surgery, in fairness, it was brutal. Go home and see all those other cats. All 200 of them. Janet's tongue is very obvious. It has changed in its anatomy. It's much thicker at the back. It's a little bit irritated at the front. But I'm hopeful that once she starts to be able to close her mouth, her tongue will go where it's supposed to be, which is back in there. So here's Janet from another planet.
Gosh, Janet, do you even recognise your mother?
Feel straight away she's purring. I think it's amazing that you've got over 200 cats, and she definitely recognises you.
I think she does, doesn't she?
She does, for sure. Yeah. So I hope your relationship isn't going to suffer with what I'm going to have to show you now, which is the physio.
Okay.
All right. This will definitely be a two-person job.
Yes.
So Jess, as you can see, is holding from the back there, and then the person at the front, all you want to do is just open and close this mouth. So relatively gently at the start, and then just a little bit of pressure once you get to the full open point.
Okay.
And then closing, so pop the tongue back in and then close the mouth, all right? And then just a little bit of a nice face massage,
Right.
you know, around those jaw muscles, and just breaking down any attachments and just basically giving her a bit of fuss and love. Hey, baby, hey, yes. Well, my little inspiration, it's time for you to get back to all those feline mates of yours, hey? All right, hey, let's send you back to the sanctuary. Good girl. Mwah. Oh, you've been so amazingly brave. Incredible.
I'm so pleased to be taking her home. I mean, I really didn't quite know how things were going to go. It was such a big step to go for this surgery, a huge step. I'm so excited that she's had all of this done, and it's fingers crossed. Now we've got to give her all the aftercare that Scott has advised. So I'm very excited and very, very pleased. Really appreciate everything that Scott and all of his team have done for Janet.
All right then, Liz. It's been an absolute pleasure and a privilege to do this, and I really hope that she continues to get better, and that I'll be able to come back and see her in all her glory soon.
Oh, that would be wonderful.
Yeah. All right, take care.
Great, thank you so much.
My pleasure.
Thank you hugely.
All right, bye, Janet.
Come on, Janet.
Be a good girl.
Bye, Jess.
Bye, take care.
Thank you.
Be brave.
When we get Janet home, she's going to have a welcoming party, but nothing to make her too excited. No fireworks. I'll just have some balloons. Everyone will be really pleased to see her, give her a kiss and a cuddle. It's good girls.
Today I'm back to see Liz at the cat sanctuary to check out Janet and just see how she's going after that mammoth jaw surgery.
Hello.
How are you, gorgeous? You well?
Come through.
Thank you. Hello. Hello, feline friends. How are you?
Hello. To the welcoming party.
Yes, very welcoming. Hello, beautiful. Hello. So So Janet's in here?
Yes, this is the inner sanctuary.
Wow, Janet's got her own room now.
Yes, it's supposed to be a cat-free zone. But,
well, that's not
have...
working out very well,
no,
is it?
No, it's not working. And here's Janet.
Hello, beautiful. Hello, gorgeous. How are you? How's she been going?
Really amazingly good. I mean, fantastic, yeah.
Really?
Astounding.
She looks amazing. I mean, one of the biggest things I can notice straight away is that her tongue is now living pretty much in her mouth,
yes.
Which is nice.
And actually, it is usually more so than it is at the moment. And she's such a happy look thing, very bright, very sort of, you know, charging around. And she's actually biffing some of the other cats, like having little kangaroo
Getting a bit of
fights
spirit
and
back.
Playful and
good.
Really bright. Janet's been a really good patient, actually, surprisingly. I thought she might be a bit of a handful. But no, she's been really good. She actually seemed to even enjoy the physio, really.
So from physio and everything else, she's actually now, like, eating proper food, is she?
Yes, she is, yes. And she's washing herself, grooming.
Wow.
Just really active as well.
She just is the picture of how she looks so beautiful, and I can hear that purr from a mile away. Yeah, she looks beautiful. Oh, you're going to give me a nibble. Never have I wanted to be bitten by a cat more.
No, I know, this is it, isn't it? You can't really complain. You just think, oh, that's good, that's good.
I'm going to say it's a love bite. That's what I'm going to say. Oh, yeah. It's always difficult when you do a major surgery like this to a cat that's been that way for a while. But now I can very happily say we've been successful. This is now a healthy, comfortable, happy cat who has a functional jaw. It's an amazing result.
Oh, we've got Rosie joining us.
Oh, look, she's even biting Rosie.
That,
oh, look.
come along, she says, you get out of it. This is my time.
And now, on reflection, a worthy
I'm so
journey.
Pleased. Absolutely, definitely.
Oh,
yeah,
so
and
good.
I'm
I'm really happy for
really
you.
Thrilled.
Really happy for you,
Yeah,
really happy
fantastic.
for her. And I'm sure we'll go on that journey with another cat at some point in the future.
We'll have a little queue for me.
An orderly queue of over 200.
Yes.
Not all at once, guys. Not all at once.
No.
Can you see the vet now? Good boy. It's okay.
Hiya.
Hi there.
You're all right.
Hi. Yeah.
What's happened?
He's had a bit of a run-in with the schnauzer.
Okay.
He got chased and then knocked over, and then I think he's hurt his hind leg.
Okay.
He's been crying a lot.
Oh, mate, let's have a little look. Pop you down. Good boy. Just hold him there for me.
He's been in a lot of pain. He cried straight after, which is not like him. He doesn't bark very often, but he really screamed.
Gosh, I don't like the feel of that at all, and he's so tender. I just touch it and he's painful. And nothing normally stops this dog wagging his tail.
Yeah, exactly.
Hey? Oh, buddy, is that sore? Feeling his foot, straight away I know that there is something going on here. It does feel like there possibly is a break. So do you think he's maybe fallen down a foxhole, a rabbit hole?
Yeah, possibly. Yeah, he took a really bad tumble. I couldn't see exactly what happened, but he just suddenly started screaming after this other dog chased him. So.
Yeah, Monty, poor boy. He's such a nice, sweet dog. He's so affable and easygoing. I think what I'm going to do is just take him downstairs and do a conscious X-ray. Okay. So I'll just pop him under the X-ray machine and just see what's going on, and then we'll work out what we're going to do about it.
Okay, great.
Good boy. Come on then, let's go. Come on. Good boy. Brave boy.
I'm feeling terrified. I'm really worried there's something seriously wrong with him, but hopefully Scott will be able to fix it.
Oh, here's poor Monty, Ems.
Hey, Monty.
Hey, look at him.
Oh, little buddy, he got a sore foot.
He does. It feels very weird, so I'm going to just take some quick X-rays. All right. You're such a good boy. Yeah, just like that.
Give me a shout when you're ready.
Yeah.
X-rays.
Yikes, Ems, take a look at that.
I can see it from here. That looks awful.
Better go and deliver the news to Nicola. Hi, Nicola, thanks for waiting. Well, it's not good news, I'm afraid. I think it's best that you come down and see the X-ray and then we'll talk about it.
Okay.
Okay, come on down. The injury is substantial He has 3 breaks in the bones called the metatarsals, which are in the foot of the back leg, and they're all splayed at different angles. Looks awful, doesn't it?
Yeah.
Yeah, probably way worse than you imagined.
Way worse than I imagined. I just thought it was a sprain or something. I had no idea.
No wonder he screamed. I'd scream. That is going to be very painful indeed. And there's no doubt that we'll need to perform surgery. We need to fix the alignment of those fracture sites. At the moment, all those toes are all jumbled up and crossed over each other.
Seeing the X-ray, I was actually horrified. I am no doctor, but I could see that his bones were all over the place. I thought it was just a sprain, or I really had no idea. So it's really frightening to see that.
Looking at that, I'm going to perform a surgery. It's akin to being like the blades of Wolverine, but instead there's pins going down all the toes, and they're going to place them all back into alignment, and the healthy toe acts as a splint for the other 3, and then we place a splint on the back. Once we've put the bones where they should be and in perfect alignment, that should heal really quite nicely. But it's a painful process. He's in pain now, he'll be painful after the procedure, and going home he's going to have a lot of enforced rest, which for a puppy, that's going to be fun, but it's going to have to be done so we get the best result possible. So it's best that we just dive in, fix it as quick as we can, and get him moving on with his life.
I absolutely love Monty. Monty is the most amazing little puppy, and so actually have to leave him here overnight as well is pretty frightening.
All right, I'll walk you out.
Bye, Mum. What a brave boy.
Hey, brave boy.
Brave boy. Oh, I know. I'm sorry.
He used to be our #1 fan. I don't know if he's going to be anymore.
I know, bless him.
Yeah.
All right, buddy.
This surgery is quite complicated because not only are we fixing 3 broken toes on 1 foot, but also it's the anaesthetic of a puppy. They're quite delicate, and it will be a long anaesthetic, and that means that it's increased in its risk.
Do you want him on his back?
Yeah. Okay, so Nathan, if you focus on the foot and as you put them together. Wow, Ems, like, look at that. That is the absolute reason why we need to do this surgery. Can you see how his foot, it should be straight, and instead it's like that. He's like a duck. And that's because all of those long bones here, the metatarsals, are broken. And the most important ones, 3 and 4 in the middle there, are also broken. So they're the ones that take all the weight of this dog. So clearly, that isn't going to work for Monty long term. The surgery that I'm going to perform today is basically pinning all those 3 bones. Because there is more than 1 broken, normally in the case of a foot fracture, you've got other toes that will naturally splint the broken one. But in this case, we've got 3 and are all moving in different directions. So what I need to do is to place a pin into them and then realign them so then the bones can heal naturally in the correct position. So see that there, there's a big tendon going down. The main complication when doing a surgery on the foot and trying to fix these types of fractures is that there's a huge amount of blood supply, so blood vessels, and there's also lots of ligaments, tendons, and nerves. So you have to navigate past all of those to fix the fracture and then close. So it does mean that it is a little bit risky and challenging, and you have to take your time to make sure you fix something without ruining something else. Yeah, that should be perfect. So I'm just putting the first pin in. So that's nicely positioned there. And so if I take 2/3. Oh, this is going to be the fun bit. Fiddly, particularly as the bones are so small, they're going to be so easily broken. This is challenging surgery. His bones are so tiny. When I'm trying to place the pins into a very narrow space, the danger is that the bones can shatter just as I'm trying to fix them. This is really bad. This foot is absolutely destroyed. Just very, very fiddly, tiny, tiny little bones.
Can we push it in further? Is that what you're trying to do?
No, it can't go any further. So now we need to pull it out. Normally in the case of a foot fracture, you've got other toes that will naturally splint the broken one. But in this case, we've got 3 lined up in a row that are all smashed and are all moving in different directions.
Yes. Nice.
That's excellent.
It's already changed the shape of the foot, hasn't it? Really nice.
All right, so that's one. Getting there. How's Monty doing, Nath?
I'm happy this end. You happy that end?
I'll be happy when it's fixed.
You want to swap? I'd rather be your end.
He gets sweary during fractures.
Do you want me to give you some traction from the other side?
Yeah. Ready?
Yep.
Yes.
Very nice.
So that is that. You can see that now that foot is straight, the toes are straight. It's hard work. A few swear words thrown in, but a good result for Monty and for Nicola.
X-rays. How are we looking?
Look, yeah, that looks great. Those bones are going to fuse together quite nicely, and now they're all in alignment. We should get the result we're looking for. So,
Fantastic.
hooray!
Good job.
Yeah. All right. Boy, oh, that was horrible, wasn't it? Hey, for you and for me. Hey, you're woken up. Clever boy. Clever boy. It's a bit sore. It's a bit sore. Oh. Is your family here to see you? Yes, they are. Yeah.
Do you think he's going to jump up and down, or do you think he's going to try? Yeah.
We really missed Monty. He's been away for a couple of days now, and the house is so quiet without him. I think we've now realised just how much he means to us. Guys, excited about seeing Monty? Yeah, I can't wait to see him. I hope he's missed us as much as we missed him.
Hello.
Hello.
Hi, guys. He's a very, very brave little dog.
Very brave.
Yeah, because you know he broke his foot. Do you know that? Yeah.
Look at him.
Well, look how brave he's been. And now, surgery was long and intense at times, but we got the good result that we wanted, which is that he woke up fine. It's really great for me to know that Monty is back in the loving arms of his family, and now he just has to recuperate over the next 6 to 8 weeks. We'll be monitoring him very closely, doing further x-rays, and hopefully his little toes will heal perfectly well and he'll be running around in the park sometime soon. Now we just need to tell him that schnauzers are actually quite nice. Yeah, all right then, you enjoy.
Thank you so much.
No more falling down holes.
Yeah,
okay?
no more schnauzers.
All right, and we'll
Thank
see you
you
very
so much.
soon.
Thanks, God.
See ya.
Thank you.
All the best. Bye, kids.
Bye.
See ya.
Come on, Monty. Let's go home, guys.
Yeah.
We're gonna go home.